But once again, thank you so much for joining. Welcome to the Gender Transformative Policymaking to Advance Access to Family Planning webinar organized by FP 2030 Asia and the Pacific Hub. My name is Dakshita Vikramaratne. I'm the Senior Technical Lead for Advocacy, Accountability and Partnerships of the FP 2030 Asia and the Pacific Hub based in Kuala Lumpur, Malaysia. I will be the host of today's webinar. The Gender Transformative Family Planning Policymaking Initiative is a regional effort led by FP 2030 to connect family planning, SRHR, and gender equality to catalyze action among coexisting but often siloed spaces. Through this initiative, we seek to bridge gaps between family planning, economic empowerment, and social transformation by advocating for policies that prioritize gender equality, reproductive autonomy, and rights-based access to contraception. So as FP 2030 Asia and the Pacific Hub, we are organizing this regional webinar today to accelerate momentum, strengthen multi-sectoral collaboration, and ensure that family planning policies are responsible to the lived realities of women and girls across our region. So just before we start off, a little bit of housekeeping. We will first introduce the webinar very briefly and go through the objectives. I can see that participants have already started introducing yourself. As soon as you join, please once again put your name, organization, and the country you are coming from. You can, as webinar participants, raise your questions in the chat below. And then also, we are very glad to say that we have participants joining from Central Asia. So if you are comfortable listening to the webinar in Russian language, you can change the interpretation into Russian at the bottom of the your Zoom screen. You'll see a logo of a globe, like a circular globe logo saying interpretation. Click on it and click Russian, and hopefully you'll be able to hear the Russian interpretations. At the same time, we will be recording the webinar, and then we will share the webinar recording at the end of the webinar as well in a couple of days for you, for you to listen to the webinar again or share it with your colleagues and networks. So thank you so much once again for joining and for your patience in terms of starting the webinar. The objectives of this webinar, as I said earlier, is to have a conversation around the intersection of family planning, SRHR, and gender equality. We are looking at catalyzing action among these three coexisting but often siloed spaces. Through this webinar, we are looking at achieving three main objectives. One, have a regional dialogue on gender transformative approaches. We have a number of panelists coming from multiple different organizations. Our partner organizations include representing government partners, youth organizations and civil society, development partners, and the donor community. And the second objective of the webinar is to advocate for a bold and unwavering commitment to gender equality in the context of family planning and SRHR initiatives. We will talk a lot more about the present moment for us to stand our ground and amplify our voices, particularly given the pushback against family planning. And the third and the most exciting objective, personally to me, is the launch of the Made Possible by Family Planning campaign in Asia and the Pacific region. So we'll start the webinar with a small description about the campaign and with a couple of digital videos we have developed for the campaign. So without further ado, let me invite the Managing Director of FP 2030 Asia and the Pacific Hub, Ms. Sumita Banerjee, for her opening remarks and frame the conversation of the webinar. Over to you, Sumita.
Thank you, Dakshita, and once again, my deepest apologies to all of you for having kept you waiting. Unfortunately, technical glitches happen, and then we were just trying to sort it out. So good morning, good afternoon, I don't think it's good evening, but depending on where you are joining from, and a very warm welcome to all of you. So, thank you for taking the time to join the Asia Pacific Regional Hub for this very important webinar as we officially launch the Made Possible by Family Planning campaign in our region. A very warm welcome to all our panelists, and again, apologies to some of you for having kept you waiting due to the technical problem in you joining. And thank you for making the time to join us despite your busy schedule. So we have here Anand, Upala, Nana, Bilima, and I think Dr. Sufia will be joining us shortly. So thank you very much. Um, it is an honor for me to speak to you today on this very important topic, which really is forms the foundation of the campaign, but it also lies at the heart of public health, social development, and human rights. So it is the transformative power of family planning, promoting gender equality and social inclusion. So let us get, as I think a lot of us in this room are from this sector, and we know that at its core, family planning is not just about contraceptive use or the very wrong notion that family planning is about population control or fertility reduction. Let us be clear that family planning is about choice, autonomy, and the ability of individuals, especially women, to have the agency to decide whether, when, and how many children to have, and also the right to fulfill their aspirations and goals for themselves, their families, and the communities. So, let me start by giving you a few examples of what family planning has made possible in some of the countries in our region. Let's look at Bangladesh. Now, studies have shown that a third of Bangladesh's GDP growth can be attributed to its strong family planning program, which strongly increased female labor force participation in the country. Thailand also provides a model of a country that successfully integrated family planning to achieve its development goals, including higher levels of education for its girls. In fact, economists have credited family planning as a key factor in Thailand's economic transformation into an upper middle income country. Another example is Indonesia's family planning program, which has allowed it to reduce infant mortality and improve maternal health, while the World Bank estimates that investments in family planning contributed to a 15 to 20% increase in household income over time. India, too, through its robust family planning program, has made significant strides in improving maternal and child health over the past 2 decades. And family planning has been a cornerstone of its economic progress as well. So, with that perspective, let me get back to today's webinar topic and frame why family planning is important, specifically for gender equity. And you will hear more on this from all our panelists here today. So, we know that traditional gender norms often place women in roles that are centered around caregiving, motherhood, and family responsibilities. Family planning challenges these traditional expectations of a woman by giving her agency and the right to choose, allowing her to pursue her education, her career, her aspirations alongside or beyond motherhood, and also contribute to her family, to her community, and to the national economy. So, family planning challenges traditional gender norms that also place the burden of reproduction solely on women. It creates a space for shared decision making between partners. It encourages male engagement in reproductive health, and in doing so, it fosters more equitable relationships and strengthens the foundation for gender equality. Now, let's talk about social inclusion. So, marginalized populations, whether it be due to poverty, ethnicity, disability, geography, they face systemic barriers in accessing family planning. And these barriers are deeply ingrained within the social, cultural, and political structures within our societies. When access is denied or restricted, it reinforces exclusion and deepens inequity. So, inclusive family planning programs which reach adolescents, people with disabilities, rural populations, migrants, refugees are essential for achieving universal health coverage and ensuring that no one is left behind. They empower individuals to make informed choices without fear, stigma, or discrimination. And the ripple effects are powerful. So, inclusive family planning contributes to poverty reduction, improved educational attainment, economic growth, and building more resilient communities. It is a strategic investment in health, but it goes far beyond health. It covers the economy, but also helps to achieve social justice. And this requires action from all stakeholders, including many of us present here, or rather, all of us who are present here today, be it donors, governments, academicians, civil society, to ensure that family planning continues to be prioritized, especially in the current environment. Governments must ensure that family planning services are affordable, accessible, and culturally sensitive. Policies should safeguard the rights of women and girls to be able to make informed decisions. This is also the message that the campaign hopes to get across. So, before I end, let me mention that today, in an era of declining fertility across countries in our region, we see a pushback on family planning. This is because we continue to associate family planning with fertility rates. But in today's world, we need to move beyond TFR. A narrow TFR lens, which is a demographic indicator, often leads to misconceptions around family planning as a tool to control population size or reduction in fertility, instead of being seen as a core part of sexual and reproductive health and rights, which can lead to underinvestments in provision of programs, commodities, and services, along with campaigns of misinformation. So let us remember that family planning is about empowering individuals. It is about unmet needs, contraceptive autonomy, method choice, and the quality of services. It is not a privilege, but a fundamental right, a right that has transformative power to change lives at an individual, family, community, and national level. When we uphold this right, we take a bold step towards a world that is more just, inclusive, and equitable, but also which ensures a prosperous future for all of us. I warmly welcome you and hope you enjoy the discussions today, and I will pass it back to Dakshita to introduce the campaign. Thank you.
Thank you so much, Sumita, for your encouraging and inspiring remarks. It is indeed an important moment for all of us in the Asia and the Pacific region as advocates, activists, partners, conveners, working towards ensuring voluntary rights-based access to family planning. So thank you so much for your leadership. Moving forward, we will do a very quick presentation to introduce the Made Possible by Family Planning campaign to all our participants. I'm waiting for my colleague Sadia to share the slides of the campaign presentation. And once we go through the campaign introduction, then we'll be transitioning into the panel discussion with our esteemed panelists. Sadia, if you can put the slide on the presentation mode. And if you can go to the first slide, please.
These are not working. It is not working.
Shall I try and reshare my, oh no, you're doing it again. Okay.
Dakshita, can you try? My screen just gets stuck.
Sure. All right. Definitely technology is not our friend today, but thank you so much for your patience once again, everyone. Made Possible by Family Planning. Made Possible by Family Planning is a campaign initiated by FP 2030. We launched the campaign at the UN General Assembly last year in September in New York, United States. Although this is a global campaign, our focus is regional. We are looking at engaging with country partners. So the campaign is not just by FP 2030, it is for everyone who's working in ensuring voluntary and rights-based family planning access. As you know, there's decades of progress around women's rights, accessing contraception and healthcare, and women's health are on the chopping block if we are not to act right now and decisively. We know that family planning has the ability for women and men to choose if and when to start a family and to have safe, reliable access to modern contraception. It directs to save lives and transform countries. So the objective of family planning or the results of family planning is not just in terms of planning your families, but it has positive ripple effects in terms of saving lives and transforming your countries. But for too long, the global family planning agenda has been underfunded and neglected. And with the current geopolitical changes, there are more and more challenges in terms of ensuring sustainable financing for family planning programs, but also ensuring there is a proper undisrupted service delivery, making sure that women and girls at the grassroots levels in all their diversity have access to a variety of methods around family planning to make independent decisions. In this context, we as FP 2030, the largest global partnership which having a singular focus on family planning, has launched this collective effort as the Made Possible by Family Planning campaign, with the aim to highlight the importance of creating an access to contraception and reproductive freedom, which leads to having healthy families, thriving communities, economic empowerment, and unlocking dreams. As I said earlier, this is a community-led global campaign to build a world where everyone, everywhere has access to contraception and the right to pursue their dreams. The campaign has three main goals. The first goal is in terms of increasing funding. We are looking at raising $1 billion US dollars in new commitments and funding for family planning. Second objective is on sparking new leadership. We are looking at generating new champions, new voices from high-profile influencers to community-level leaders to ignite change. And the third objective is igniting new momentum. We are hoping to re-energize the family planning movement and spark a new narrative for family planning, positioning family planning as the bedrock for economic growth, gender equality, empowerment, and autonomy. So in terms of increased funding, we have, as I said earlier, an ambitious goal to raise $1 million USD in financial commitments and pledges. We are doing the campaign leading up to International Conference on Family Planning in Bogota, and we are hoping that by that time we'll be able to achieve this ambitious goal. At the same time, we are mobilizing new voices as the second objective. The Made Possible campaign seeks to shift perceptions of family planning, and we are hoping to connect new audiences and bridge the gap of understanding from where we are to where we want to be. In this context, we are engaging diverse voices who are influencers, who are champions at the global level, at the grassroots level, at the regional level, who are energetically speaking about the importance of family planning, and we are trying to see how we can organize a series of digital conversations and activations through these champions. What you see on your screens are some of the digital influencers we have engaged so far through our networks, and all these influencers have been actively speaking about family planning. If you go to our social media channels, you can see their videos, their engagements, and we are looking for more and more influencers to join this campaign as well. But at the same time, our campaign is not only limited to digital influencers or social media players, but we are also looking at generating stories from the community level. So you as activists and advocates and the people you work with at the community level are the face of the campaign. So we want to hear from you. We want to hear from the actual users of family planning. We want to hear from young women and girls in terms of their experience of using family planning methods. What is their journey? What are the challenges they are faced? What are the victories? Why for them it's important to have family planning accessibility? And our third objective of the campaign is to look at establishing family planning and surging new momentum around family planning. And we are hoping to do that through global convenings. We are hoping to do that through regional convenings. We are hoping to do that by identifying national moments, strategic moments where we can shift the narrative around family planning. And for that, we need your help to identify moments which you believe is important in your work at the national level, subnational level, or at the regional level. And we are hoping to equip you with the technical resources and digital assets to position family planning in those moments to shift the narrative. So we are welcoming all of you to join this movement. We are hoping to tell the story of what family planning has made it possible. You can join through your organizations by making a commitment. You can join the fight by sharing your stories. You can use your networks to host a convening or mobilize a digital conversation around the campaign. And you can share your own story through your social media channels or by submitting your stories to us. We have a new evolving digital toolkit which we have developed, and we'll share the toolkit link to all of you who have joined and registered for this webinar after the webinar. And through the toolkit, I hope that you will find it convenient to share your story by some of the templates we have already included for your convenience in terms of using those templates when you are posting your stories on social media channels. So we are very excited for the campaign of FP 2030 made possible by family planning, and very much looking forward to engaging with all of you leading up to the International Conference on Family Planning in Bogota, Colombia at the end of this year. So this is the end of the presentation, and we'll go on to play the official campaign launch video if technology has become our friend now. And I'm really hoping that the video, we'll be able to play the video, but otherwise we can move on to our plenary discussion. So Sadia, I'm going to stop sharing my screen and hoping that you will be able to play the video.
What is at stake when we cannot control our lives?
As a young single mother in Nigeria, I understand that I am privileged to have access to family planning. Without this, it would have been financially strenuous for me as a young single mother.
Family planning isn't just about having kids, it's about planning for your future and deciding when and how you want to live your life.
At 25, I am deeply immersed in my passions: singing, acting, content creating.
My journey was made possible because I had the power to choose my timeline.
I'm a business owner and a mother of 2 beautiful boys. Having the access as to when we wanted to have children helped us ensure opportunity and possibilities.
I've always had a desire to have a child, but also always had a desire to have the career that I've always dreamed of. And I knew that if I planned things accordingly, I could have all of those things.
There are many things we can't control. Through planning, I'm able to do all the things I need to do for my family.
These stories aren't rare. They reflect what's possible when family planning is prioritized and accessible.
When women have access to family planning, they can pursue education, careers, and entrepreneurship, strengthening economies. The ripple effects last for generations.
It means that women can invest in their family's well-being, young girls can stay in school, and industries can benefit from the contributions of more empowered women.
Planning your life shouldn't be a privilege, but for too many, it still is. Funding for family planning is under attack. Rights are being rolled back. Progress is at risk.
family planning should be a basic right accessible to all.
At a time when family planning is under threat, the urgency to act has never been greater.
No one should be denied the ability to safely plan their future.
Let's make that possible for everyone.
Share your story today.
Raise your voice.
Amplify the message.
And let the world know how important it is to have access to family planning.
Stand with us. A brighter future for all, made possible by family planning.
Thank you, Sadia. Finally, some technology is working for us, so that's good news. I hope we are heading towards the correct direction. At this point, let me invite Sumita Banerjee, the Managing Director of FP 2030 Asia and the Pacific Hub, again to introduce the panelists and moderate the panel discussion. Sumita, over to you.
Thank you, Dakshita. I just think that one of our panelists is still having a problem joining the meeting, the webinar. But in the interest of time, we'll start, and then once she's able to join, then we'll have her in as well. So many thanks to our panelists. We have with us here today Upala Devi, who is the Regional Gender and Human Rights Advisor for the Asia Pacific region with UNFPA. We have Anand Sinha, who is the Senior Regional Advisor for the David and Lucille Packard Foundation, Nana Woodham, the Executive Director of the Planned Parenthood Association of Thailand, and Belima Tukibeva, the Youth Focal Point for FP 2030 with the Kyrgyz Republic. We also have Dr. Sufia Yunus, and she has not been able to join us yet. She is the Director General for Population for the Government of Pakistan. So without much ado, I'll start our session now. And also another piece that I think before we start, we also want to acknowledge that the Honorable Shashi Kiran, she is the Minister of Women and Family Development from the Ministry from Fiji. Unfortunately, because of the meetings there were some meetings that came up and she was unable to join us for this important meeting. She sends her regrets and she hopes to join at another time, and we will keep doing this as we roll out the campaign. We will have other opportunities as well, and we will have her included at that time. So I think since we are already running behind schedule and we want to leave aside some time for question and answers, I will move straight away to you, Upala. Maybe, Upala, you can tell us what role do you see UNFPA playing in advancing a gender transformative approach in family planning in its work with policymakers to ensure that family planning programs go beyond just offering contraception, but also address entrenched norms as well as power imbalances? So over to you, Upala.
Sure, I can do that. And thank you, Sumita. So I'll start by, welcoming my other distinguished panelists, esteemed colleagues. I see many colleagues who I know on the chat box, and of course, passionate friends joining us today. Thank you. And thank you, FP 2030, for giving me the space. It's with actually profound gratitude and a deep sense of urgency that I sit before you today. Thank you all for inspiring energy and unwavering dedication to realizing girls' and women's fundamental rights to make informed choices about their own bodies. Sumita, as you rightly mentioned in your opening remarks, bodily autonomy, the power to decide what happens to our bodies, the decision-making power over sexual and reproductive health, coupled with access to essential information services, is actually not a privilege. It's a fundamental human right we're all born with, and yet unacceptably, tragically, far too many women and girls are denied these basic rights, birthrights as I call them. So let us confront the stark reality. As UNFPA's 2021 State of the World Population Report revealed, at least 40% of women and girls in the Asia-Pacific region are robbed of their rights to make simple, yet very profoundly consequential choices about their own bodies, about sex, about contraception, family planning methods, and healthcare. And these are evidence-based statistics, 40% in the Asia-Pacific region. This is not an abstract statistic. It literally represents millions of individual stories of denied agency, shattered dreams, and compromised health. And this denial violates not only their rights to bodily autonomy, the power and agency to make choices about their own bodies without fear, violence, or coercion, but also their rights to bodily integrity, the ability to live free from physical acts to which they do not consent. And these pervasive realities are often underpinned and perpetuated by gender inequality, deep-rooted social norms that we must dismantle with every tool at our disposal. So it's against this backdrop that UNFPA has been working for a very long time with governments, civil society, and UN partners in Asia Pacific, and of course globally as well, to tackle these fundamental challenges. Our UNFPA supplies programs has been a lifeline, providing essential family planning commodities to developing countries, empowering women and couples to choose when or if to begin with to have children. Our maternal health programs are driving governments to invest in and professionalize midwifery, ensuring safer pregnancies and childbirth, and drastically reducing maternal mortality. And crucially, very, very crucial, because this region is very prone to disasters, natural disasters, we integrate these vital issues into our humanitarian response interventions for women and girls impacted. But we know as UNFPA, as the UN, that we cannot and do not work alone. We work in partnerships with policymakers, civil society groups, communities, feminist groups, youth leaders. They represent the multi-sectoral cross-section of actors needed to ensure a gender transformative and rights-based approach to family planning. Really, we cannot do all of this alone. So this involves not only securing and ensuring access to services, but also then addressing the underlying social norms and power dynamics that restrict individual reproductive choices. So today I've been asked to focus on our rights-based and gender transformative work with policymakers in ensuring that women and girls have the right to choose and to access quality sexual and reproductive health services. Our approach is multifaceted, and there are four aspects that I want to briefly dwell on in 2 minutes. So firstly, and of course, this all relates to our work with policymakers. So firstly, UNFPA engages in robust policy advocacy, promoting frameworks that integrate gender equality in family planning policies. We work with governments to develop national strategies that recognize reproductive rights as fundamental human rights, ensuring that policies are inclusive and equitable. That's number one, policy advocacy. Number two, we collaborate with policymakers through comprehensive capacity building initiatives. This involves training government officials, stakeholders on the critical importance of integrating gender perspectives into family planning programs. Because we know that from experience and evidence that by enhancing the understanding of gender issues, policymakers can create more effective and inclusive policies. So policy advocacy is one, capacity building is two. Number three is the power of data. We cannot underestimate the power of data. So what UNFPA is doing is supporting the collection and analysis of data related to family planning and gender dynamics. By providing evidence-based insights, we help policymakers understand the specific needs of diverse populations, including marginalized groups who are often the farthest left behind. And finally, UNFPA advocates for comprehensive policy frameworks that explicitly addresses power imbalances in decision-making processes related to family planning. This includes promoting women and girls' leadership in health governance and ensuring that their voices are heard in policy formulation in a very participatory rights-based manner. So let me illustrate this with some concrete examples, the four approaches that I just spoke to. In India, for example, the rights, and Sumita, you just mentioned India anyways in your remarks as well, opening remarks. So in India, the rights-based approach has been adopted as an integral part of the National FP 2030 vision document and state roadmaps in 4 UNFPA-supported states, Bihar, Rajasthan, Madhya Pradesh, and Orissa. Our advocacy has led to the expansion of the basket of choices, introducing new methods and focusing on informed choices, quality care, and going the last mile, literally reaching the last mile, ensuring that the farthest left behind are not left behind. In Pakistan, Through multi-stakeholder engagement and policy dialogues, we've catalyzed commitment from federal and provincial governments to adopt the FT 2030 vision. Legislative policies include the enactment of rights-based reproductive acts in Sindh and Punjab. In Nepal, we have supported expansion of abortion services, advanced the policy environment, and contributed to development of the national medical standards for reproductive health. So, in summary, because I don't want to take too much of time, we do have a unique role in engaging with policymakers, involving advocating for inclusive policies, building capacity, utilizing data-driven insights, and promoting frameworks that address power imbalances under a gender transformative and rights-based approach. Ultimately, a woman and a girl who has control over her body and has access to sexual and reproductive health information and services is empowered in all aspects of her life, taking into account the life cycle approach. She gains autonomy, improves her health and well-being, advances her education, increases her welcome, and enhances her safety. She thrives, and so does her family, her community, and her country. So UNFPA, in conclusion, is fully committed to co-leading efforts in collaboration with all of you in realizing this vital goal in Asia and the Pacific and globally. So thank you so much for listening, for taking this journey with us, so that all people, especially women and girls, can say loud and clear, my body is my own. Thank you so much again. Over to you.
Thanks, Opala. Those were really insightful comments from you. And the work of UNFPA, of course, is a critical pillar to ensuring gender transformative approaches form a key pillar of family planning work. So we'll move to you, Anand. How do you think the donor community can be mobilized in promoting a gender transformative family planning agenda? And amidst so many competing priorities, what makes family planning a strategic and cost-effective investment to a donor?
Thank you. Thanks, Sumita, and congratulations on launching a wonderful campaign and a very relevant and meaningful campaign at this point in time. So I I'm not going to speak on behalf of all donors, but I can try and represent at least the Packard perspective on why we are engaged in family planning, and our theory of change is very clear: is that family planning by itself is important because it contributes to gender equity, and that is the rationale for family planning. This is something that the community has been talking about for decades now, and we keep on talking about it, and it's kind of amazing that we still are trying to sort of clarify, and thank you for doing that at the beginning, is that family planning is not about population, and it's not about not having babies. It's about so many other things, but the basic part of it is that it is it's about choice, it's about autonomy, it's about health, it's about ensuring that women are allowed to decide. And I think you put it so eloquently. The fact is that the breakup of how we think of men and women is that women's traditional roles tends to be about caregiving and motherhood, etc. And what are the ways in which we can actually expand and sort of offer those choices? And family planning is very much at the core of it. And there's a ton of research that tells us that it is an extremely economically effective tool to get there. So there hasn't really been a question of why do we fund it. I think there are lots of questions about why not to fund it, and I don't want to sort of add to sort of a sense of gloom mongering that I feel is happening these days. But the fact is that many people are living through very challenging and very difficult times, more than ever before, particularly people who work in this field and in this sector. And it feels like family planning, like never before, is in an existential sort of crisis. What is the purpose of family planning? There are sets of very influential forces which believe that family planning is gender equity is not a priority in the construct of the world, the vision of the future of the world as we see it. And then there are sort of again, existential crises in terms of, well, we have declining fertility, we need to grow our, populations, we need to grow our economies, and therefore we need to take on a more of a pronatalism kind of approach towards our population, and we need to think about, and this is particularly, in the context of where we are, which is in, in the Asia Pacific region, where there is concerns about declining fertility. And therefore, family planning is always seen as, well, family planning is not essential in this given context. Why should we be even doing, work around family planning? And the thing is, we've always been saying for the last 30, 40 years that family planning has never been about population control. Family planning has never been about, only about deciding how many babies that each couple should have. It has always been about an enabling tool that allows, I think I also just want to sort of, step back and acknowledge that we're talking about gender here, but we're always talking about gender in a binary situation, right? But the fact is that when we're talking about gender in the context of family planning, it's about a couple. And when it's about two people, and when it's about a couple, and then it is about two people and about the power relations that exist within that, right? And in the context of that power relationship, which is essentially in a world which is, where it is very, patriarchal norms exist on, in general, it comes down to then what is the power in the hands of women and girls that we have to sort of center around. So I do want to make that connection between thinking about gender transformative approaches, which is not a binary constraint, which is not constrained to just thinking about men and women, right? But in the context of family planning, that's kind of what it boils down to, unfortunately, right? And therefore, we do end up thinking about what is what is it that we can do to support women and girls in this situation. And this is really where family planning comes in very critically. The Packard Foundation's strategy for the next 8 to 10 years focuses on 4 key pillars. And those 4 key pillars are really more pathways to care, which is essentially about saying, how do we try and offer more ways and more avenues for couples to seek reproductive health services. Some of this is triggered by the fact that we're saying health systems are under strain. We're seeing more and more avenues of self-care happening, but we also want just more empowerment and more sort of levers in the hands of couples and users directly to seek services and to seek products that they want and need. In order to enable that also, we think that it's important for people to have better products, right? So how can we go about trying to expand the basket of existing products or repositioning family planning products to meet those needs closer to where women are? The third pillar, and I'm not saying this in terms of size of pillars, I'm just numbering the pillars in terms of 1 to 4, is locally led agenda and locally led voices and powerful voices, right? We feel very strongly that family planning, reproductive health, and rights needs powerful voices, and those powerful voices must come from within the communities that they represent, and how do we go about supporting, sort of building those voices. And fourthly, again, aligning along, with this campaign is how do we get more funding and how do we bring more resources to the family planning issue. One of the things that's becoming very, very clear is that in the given context, family planning does not have a big chair at the global table anymore, as it might have done 10, 20 years ago. It's getting sidelined due to the various issues that we've all been talking about. But that's also where campaigns like, Made Possible are so important, because it's kind of telling people as to why family planning is important in the larger context of the world that we aspire to achieve, right? If we want to see equity, if we want to see economic growth, if we want to see, better livelihoods, if we want to see better education, if we want to see, freedom from illness, family planning will need to be a continuing and ongoing part of that vision and of that dream. It's not a little capsule that you use for population control and that it lives in that little capsule. It affects everything. And I think that's one of the things that we're beginning to see, is that then we need to start talking to more and more people in different areas and in different issues, because this, the other word that we hear a lot in family planning is intersectionality, right? Is what is happening with relationship to family planning and other issues that people are thinking about, that people say are central to what we're doing. And I think that's going to be part of how we go about trying to bring more resources to family planning, is really exploring those intersectionalities and trying to help people understand how family planning is important to the kind of objectives that they may be pursuing, but which can be enabled by family planning. I'm going to pause there, but I can come back for more remarks later on.
Anand, I think you've raised some really key issues that one, of course, the importance of a locally led agenda and voices that come from within the communities. Resources continues to be a big one. And now I think the importance of really placing it at, like, talking about the intersectionality of family planning as the way forward is really another critical area. So given that, we'll come back to you a little bit later for more remarks to both you and to Upala. But we'll move to Nana. Nana, what in this context, with this whole pushback around rights, what do you think is the unique role that CSOs can play in promoting more of a gender transformative family planning agenda? You heard what Anand just mentioned, even in the context of power relations, in the context of family planning. But how do we reach, especially those who are underserved and marginalized? And maybe you can just talk about how PPAT as a key civil society actor in this space in Thailand is working to shift some of the harmful gender and social norms.
Good morning, everyone. Thank you, Dr. Sumita, and I'm very honored to be here and be part of discussion today. CSOs play a crucial role in advancing gender and transformative family planning. We ensure that the perspective of underserved, marginalized population are at the forefront of the policy decisions. So what unique about our role is the position that we engage in direct with the community and bring out what the community say, community voice, and what they need and what is important to them, to the policymaker. The community consultations, what have been done in the community, in the field, the evidence base that we correct, we can bring those to the policymaker at the national level for that to make the right decision for the rights and choice. I give you example of the situation in Thailand right now because of the low fertility. Many of the meetings that or public that PPAT as the family planning organization that we attending. At the break of every discussions, I will have at least one or two person that walk to me and asking, so what is Planned Parenthood doing? What is Family Planning Association doing when we have here, we work so much in the past and now we don't have children, we don't have birth anymore, especially in Thailand and some other country. So our role is to expand and to talk to them, to explain to them that family planning is not the result of the low fertility, but the low fertility is influenced by a range of socioeconomic and the cultural factor. This needs to be speaking as us because some of the government, they probably believe that, ensuring women want to have a baby, want to continue their career, but how this right of those women are being accepted by their choice. So I think it's very important. The CSO also help the center of the voice of those who are frequently excluded from the traditional policy making process. For example, migrant worker, non-documented migrant worker, displaced person, especially right now when we have disaster, many of those who living along Thailand and Burma border. We've probably heard many of us probably heard about the earthquake, and that impact a lot of the population along the border, not only Myanmar, in the Thai side also. How can we ensure that they access to MIS, a minimum initiated package for SIHR? So it is important that their rights be protected and support during this difficult time, which is sometimes the government may look over or they focus on in some particular area, but the NGO or the CSO who work in the grassroots, who work in the field, will be the one that who ensuring that the policy making know about all these situations from the marginalized population. What PPAT working at the moment and also working in the past, we are committed to the challenging and transformative harmful gender and social norm that impede the realization of comprehensive family planning rights. Our approach involves focus on the grassroots advocacy and high-level policy engagement through the system like research, community feedback, community engagement. We provide insight into the experience and needs of a diverse population, which would inform our policy making, policy recommendations and advocacy strategies. Our initiatives that we work with the UNFPA, we work with the government agency, the healthcare agency in Thailand. We also promote registrations and policy that are not only scientifically sound, but is also just ensuring that family planning services are acceptable, non-discriminatory and tailored to meet needs of every individual regardless of their gender, sexuality, and socioeconomic status. What we need support from the government is the technical support. As I mentioned earlier about what is the definition of family planning and contraception. Family planning is about a choice, ensuring that everyone access to their choice to make a decision if when they will get pregnant and when they will have a family or have a child. It's not about stopping having a baby. How we ensure that everyone understand that. So I think the role of the policymakers should provide a technical support to all the CSO and the public to ensure that they understand this, that the family planning is still important, especially those who have a lower economic status, that sometimes they need to wait until they have the right time for them to have a child. The other thing is the financial support. Adequate and flexible funding is essential for the long-term visibility for the CSO, especially those working in the country like Thailand or some other country that now, if we want to work on the family planning, we need to really sure that the work that we do is not against the government direction, that they want to have more fertility and have a increasing of the fertility rate in the country. The government and the donor must recognize that the value of investing in the program that addressing family planning is important. And also the last one that we would like to asking for them to support, maybe perhaps most of the important require the political environment that recognize and champion the important inclusive of gender transformative family planning. This entails not only favorable policy, but is also a commitment from the political leader to engage in the open dialogue and collaboration decision making. That will enhance the policy support, that will facilitate smoother registrations process, reduce delay of any misunderstanding of the people who just still not understand what the family planning is and what the contraceptive is, because right now we're facing that in the when we work in the country on the family planning in the country that they want to improve their fertility. So thank you.
Thank you, Nana, for your insights. Really, CSOs have such a key role to play in the current scenario around advocacy, community engagement, creating those policy dialogues between policymakers, getting heard. I think there is a lot of misconception, misinformation. Family planning, I think, as all of us have been saying, it's not about fertility reduction, it's about choice, about rights, and it's also about having forward-looking policies, because it's not about controlling, as Anand also said, the number of babies that a woman or a couple can have. I'm quite aware that we are, because we started late, we are running a bit behind schedule. So without much delay, Bilima, I would just pass it to you to probably look at, and maybe you can talk about how are young people leading or contributing to challenging or shifting these gender norms around contraception, bodily autonomy, and what kind of partnerships, resources, or platforms do young people need to meaningfully participate in shaping and as well as putting their needs forward to policymakers?
Yeah, thank you, Sumita. Dear colleagues, dear participants, hello, my name is Bilima. I'm from Kyrgyzstan, from Central Asia region. It's a region that's now a home for many young people who live, whose reality is really both like rich culture and also persistent barriers for like their rights, their different knowledge for SRHR and etc. So if I can, maybe I can share my presentation from my laptop. I think it's really short, I promise. Honestly, it's short.
So, Bilima, you will have 5 minutes, so we can just have a few quick questions as well.
Okay, okay. So firstly, I want to tell that Central Asia, it's particularly in rural and traditional communities, issues related to sexual and reproductive health remain deeply taboo. And this silence of adults, teachers, and even healthcare providers doesn't just obscure the topic. So we understand that behind of this silence, there are early and unplanned pregnancies, lack of knowledge about contraception, forced marriage, fear of seeking medical help. And I think that this silence is a form of violence, like it's ignorance. And we see that in Central Asia, young people organizing different anonymous online chat rooms in the different social platforms discussing topics on adolescents are afraid to even say it out loud, like about family planning, about contraception, etc. We also see that how teenage girls record videos in Kyrgyz or in Uzbek, like for example, in Kazakh language, explaining what menstruation is and how emergency contraception works, for example, how guys become allies on issues of consent and body respect. And this work changed not only prescription, but also the norm, because young people speak the language of their audience without shame and pressure. So they are not just educating, they are normalizing the conversation about bodies and the rights to choose. And now I want to tell about that. What inspires me is how young people themselves are breaking the silence. For example, from our side, like from Kyrgyzstan, Kazakhstan, now I can tell that the strongest example, it's a Tartunba Fest. It's an event, Central Asian event. It's first digital festival on sexuality education. It was created by young people for young people. It was not just an event, it was a platform for teenagers where they can share from their like different experiences, their knowledge. They work together to develop different interactive formats, quizzes, stories, and visual materials. We understand that we use different formal and informal like methodology for educating, for advocacy, and etc. It also peer-to-peer education, like when teens teach teens. It also really, I think that's cool and interactive methodology when we create trustive platform, I don't know, like this. Also different type of quizzes and other events. It also created by youth. It's also their initiatives. Speed dating, like on the topic of rights and health. It's a format we do with youth that really changed the atmosphere instead of boring lectures. It's a lively, dynamic dialogue. Participants move from table to table and discuss different questions. And different international organizations and NGOs, online media campaigns. It also cool, and we understand that it works because young people led the process, not just participated. And we understand that there are different problems, but if we will do it together, I think that we can do. So there is a really important coordination between government and civil society. We talked about it before, other speakers mentioned it. Investment in digital literacy is essential to combat misinformation, and most importantly, that youth must be engaged in content creators, like for law development, for like, I don't know, different information and etc., because they know how to speak their own language and reach their peers through these right channels. I think that's all. Thank you.
Thanks, Belima. Youth will, of course, always be a key player, and I think we talked about social inclusion without addressing the unmet needs of adolescents. There can be no gender equality, there can be no social inclusion, and there can be no successful family planning program. So I won't take any more time. I'll just quickly pass it to Dakshita to just do the moderation and look at the questions from the participants and get back to the panelists. So over to you, Dakshita.
Thank you so much, Sumita. Thank you so much for our esteemed panelists for all your interventions and sharing examples of the work you are doing through your organizations or individual advocates. And Sumita, I'd also kindly request you to also stay as the moderator as well, because I suppose some of the questions would be directed at FP 2030, and you might be able to respond to them. So thank you for our participants for raising some of the questions in the Q&A function in the chat. So I'll try and see which questions would be more relevant for each of the panelists, and also considering the time available for us in this webinar. So I would first start with perhaps Belima once again. I think there was a question particularly from another youth advocate in terms of the role young people play to make sure that especially young men and young people in general are engaged in the conversation around family planning. So perhaps, Belima, through your experience working as a youth advocate in Kyrgyz Republic and Central Asia, you are also wearing multiple different hats as youth advocate. You are in different steering committees and other advisory groups as a young person from Central Asia. So what is your experience, and how best can we specifically engage young men and boys in the conversation around family planning, and why is this important?
Yeah, we also talk about this problem with our colleagues, because it is a really big problem for us too, because many of our volunteers, many of our members are women, and we work mostly with women because we can't engage the men. So in our campaigns like online campaigns, in our events, we mostly do focus on like engaging men's. So we do for them special posts on Instagram, for example, do different events that maybe will be specifically interesting for them. Like, we will be talk about the contraception, about condoms. Maybe it will be really interesting for you, like this. So yes, we mostly engaging men from only Instagram and use different social platforms, I think now we work with it.
Thank you, Belima. I think you are raising a couple of interesting points in terms of creating in a very different ways of engaging men and boys in this conversation, because it's an extremely important one. In many communities, as we know, men and boys are the gatekeepers in terms of making decisions for the whole family. And some of those decisions also include decisions around whether their partners are able to use family planning methods or not. And that's the sort of the social narrative we are trying to change through our work. And in order to do that, I think it's important to have them also be part of this conversation. Vilima, you have raised your hand. You have another intervention? Yeah,
Yes,
very briefly, please.
Yeah. I also forgot to add that when we create some events, we also do something like when you remember I talked about the speed dating, like it's an event for couples, like for men and for women, and we understand that we should take like 20 men and 20 women. So it should be interesting for them and for them also. So yes.
Thank you, Bilema. Thank you. I think some of these new and innovative interventions would be very useful for our audience to hear as well. I'm gonna then look at Upala from UNFPA Asia and the Pacific Regional Office. I think I saw a question on the chat, particularly, I think someone from perhaps the our colleagues from Africa region is quite relevant for us in the Asia and the Pacific region as well. I know that UNFPA is doing incredible work with midwives who are in most cases reaching the last mile in our countries. So can you maybe perhaps speak very briefly in terms of the strategies or initiatives UNFPA APRO office is taking through the engagement of midwives in terms of empowering them and identifying or rather strengthening the critical role in increasing family planning awareness, particularly in rural and undeserved areas?
Very much. And I would be happy to speak, for example, to the work in Nepal, in Afghanistan, Pakistan, and link it up with the work that we do on gender and social norms. So we do know that to a large extent, midwives don't just necessarily come from the nursing homes and the maternal health clinics, but they also come from the communities that they live in, and we use those people as our inroads in the communities because these are the people who serve as our conduits, if you will. But we also have to understand that they come in from perceptions of deep-rooted gender inequality to begin with, and also perceptions of how a woman or girl should be behaving in a particular context, if you will. So our work really focuses on not just developing the skills as a midwife to work in the communities, but also in terms of developing their awareness and knowledge in terms of gender and social norms. Because if you don't change perceptions, values, mindsets, skills in itself are not enough for them to then attend to the women and girls in the communities. So it's really a multi-pronged effort. And as I mentioned in my presentation, which really, of course, focused on policymakers, because that was what I was supposed to be doing today, is that it's really a top-down and a bottom-up approach. The work with midwives also relates to work we do with policymakers in terms of then bridging the gap between what the policymakers state in their policies, in their budgets, in their frameworks, and then link it up with the work that we do with midwives at the local level, where we develop capacities of midwives to be trained in delivering services. And a very good example of that would be not just in Nepal or in Pakistan or Afghanistan, which is such a difficult context for us to work in, but also the role of midwives in, for example, addressing FGM, female genital mutilation. In Africa, a lot of the work that we're doing in countries are really focused on working through the midwives because they are really the conduits who are actually performing the actual cutting, if you will. So for us across the globe, the role of midwives is central in the work that we do on ensuring that women and girls can have access to safe births and also in terms of access to various services, because we also station midwives, if you will, in various health service delivery centers, not just in communities, but in schools as well. I mean, I was in Nepal the other day where I was in a very interior Muslim community where we had midwives stationed in a primary healthcare facility just next to a local school. So there are very many different entry points and many different, cross-cutting areas that links up the top-down and the bottom-up approach, where every element is key, if you will. There is not one single approach that works.
Thank you, Pala. I think you are highlighting a really important point in terms of looking at intersectionality through our interventions. And for example, the work UNFP is doing with the midwives, how can it also be approached from a top-down and a bottom-up approach to make sure that the interventions reach out to the widest communities, and it's not just creating results in terms of improving the accessibility for family planning, but how through those interventions we are also improving gender equality in the communities by engaging women and girls. Thank you so much, Upala. I'm aware that we are running short of time, so I'm gonna pick and choose a few more questions and assign them to some of the other remaining panelists. I saw a question around engagement of donors in the changing funding landscape. So I'm going to assign that question to our dear colleague Anand Singha from Pakat Foundation. Anand, as you already spoke, and as many of the other panelists also shared, the funding landscape is drastically changing, particularly for rights-based sexual and reproductive health and family planning agenda. And I think you did speak about the role of donors, particularly coming from Pakat Foundation, but anything else you'd like to add to that conversation around how can donors step in and making sure that there isn't a huge vacuum, and the continuous efforts of civil society organizations and other partners are supported in a sustainable way?
I think my one suggestion would be that the history of large donors who exclusively support large family planning programs is on a downswing. And that's not going to come back. Let's just be okay with that. And the biggest step in that is simply the winding down and sort of the dissolution of USAID, which is supported, I think the figure was something like up to 40% of family planning program funding was coming from USAID. So that has been removed from the scenario, and there are more and more large donors who are focused on family planning are struggling more and more to continue to do that. Where the horizon lies is going back to the point of intersectionality, and how do we try and think of family planning as part of a broader agenda? So whether it is thinking about climate and reproductive health, whether it's thinking about livelihood, whether it's thinking about gender equity, we will have to be clever and smart in positioning family planning as part of that. And therefore, it's important that we also begin to talk to more and more people outside of our sector, outside of our family planning community, to begin to build those bridges and to help people understand. And that's why I think, the criticality of what you guys are doing, what this campaign is all about, is really important in trying to position that sort of, conversation with a broader audience rather than talking internally to ourselves and to those converted. I hope that helps. I also want to take a stab at this one question about, I think Nazia had asked, or someone had posted there, can you share any success stories or local examples where access to family planning changed a woman's life or family's future? Go talk to any successful family or any successful woman and ask her, right, if it played a role. But she will never turn around and say, oh, it is because of family planning that I am this, or my family is so and so. But you will see that happy families and happy women and successful women all over the world have that, right? But if you go around looking for that success story to say, because I had an IUD, so I became this, it's not going to happen, okay? So let's be clear about what that success stories look like and how it lives in our lives, right? It lives there as a very integral part of any successful, any happy family's lives. Thank you.
Thank you, Anand. I think that was a very inspiring remark to sort of conclude your intervention. I think we can go back to our communities and ask from our families who are leading a successful life to understand the impact family planning has made, and also the programs done by governments and other organizations for so many decades in fact, could be the results in many sub-regions of our region where there are low fertility rates, because we look at the number of children in each family unit, you can see the decrease and how people are sort of making those informed decisions in terms of planning their families. So thank you. And we have, I think I'll take two more questions. I think I'll direct a question around CS2 strengthening to Kung Nana from PPAT. Nana, I think you have been leading PPAT for a long time in Thailand, and we are also in the process of working with the government of Thailand for finalizing a national family planning commitment. So in that context, I think the question is around how can organizations like PPAT and other CSOs can strengthen your own institutional capacities to integrate a gender transformative lens in your programming and advocacy efforts you do at the national level, particularly looking at family planning?
I just mute myself. Thank you for the question. I think it's very important. Let me speak on behalf of those who are working for marginalized. We gathering informations and gathering data from the research that see that the importance of family planning is important. It's not just for those more successful family or successful women, but it's also for those marginalized and population. I give you an example. I will come back a bit because I was reading the questions, but I also want to say something and share something about the success story of our work. For the migrant and non-registered migrant in Thailand, they cross the border and work in Thailand. Some of them has to make a commitment that they cannot pregnant, otherwise they would be deport out of the country. So the family planning has helped them to continue their career while they have to spend a lot of money to cross the border and work as employee, and then the employer tell them that, okay, if you're pregnant, then you lost your job. They have nowhere to go. The families planning also help them. We have many cases that came to us and for the service, and that's really helped. So some of these information and the data we proposed to the policymaker to continue the campaign of we cannot leave anyone behind. So our work is to bringing the information from the field and speak at the national level and ensuring the family planning program is continued, and not only for the Thai, especially those under the universal health coverage. It need to cover those who needs to access to family planning and SIHR in Thailand. So, thank you.
Thank you, Kundana. I think these are very critical points in terms of looking not just externally but inwardly as well through our organizations, the institutional structures we have, our framework, and how can we change using the resources available to us internally to make sure that our organizational interventions and our programs and activities are also leading towards gender transformative actions. So I think true reflection in terms of who we are, what we do, the methods we use is equally important as much as when we develop external facing interventions as well. So I'll take one more question, I think, which is also a very timely question for us in the Asia and the Pacific region. And I will ask Sumita to respond to that question. Sumita, in your role as the Managing Director of Asia and the FP 2030 Asia and the Pacific Hub, the future of family planning in terms of, in the context of declining or reducing global fertility or low fertility, why do you think we need to keep talking about family planning even when the fertility rates are declining? And what are we doing as a community and as the regional hub to establish family planning in the center of the low fertility and declining fertility discussion?
Thanks, Dakshita. I think, like I mentioned in my opening remarks, family planning has never been about fertility reduction or increase or decrease. It's never been about that. It's been about, and as the panelists have spoken here, it's been about choice, recognizing women's agency, recognizing the transformative power that family planning has, giving women the choice to decide on their future, their aspirations, their goals. And there was a question from Jacqueline here that there are couples who may want more children, and that is what family planning is about. It's not about reduction or increasing. It's about giving them a choice, but also having the facilities and the policies that allow women to possibly have more children when they want to have more children. So having that framework available to them and having those policies that are in place. So in terms of what is the hub doing, we are working with our colleagues at UNFPA APRO. We are developing a paper in partnership with the Population Council as an implementing partner, looking at reclaiming and looking at putting family planning, rights-based family planning in low fertility context, so having the right messaging, getting the right messaging across that why is it so important to move away from TFR. So if we look at our region, it is a region with high unmet needs. We have countries like Laos, which have a 90 birth rate of 90 per 1,000 young people. We have teenage pregnancies, which are extremely high in countries like the Philippines. So we really need to address those, and there is a high unmet need that needs to be addressed as well. Also, we'll need to look at the transformative power that family planning has. How can it help to meet the other SDGs, whether it be education? All the countries in this region are aspiring for economic growth, economic development. And let's not forget that family planning has actually played a critical role in that. If we look at countries in East Asia, and we do hear a lot and see a lot in the news around South Korea, Singapore, Japan. But let's also remember that there is a reason, because the family planning programs have taken a very reductionist approach in many contexts, but that is not what family planning stands for. And as a regional hub, we are here to promote rights-based family planning. We are here to bring new partners into the fold for family planning as part of this campaign. There was a question from Jamil from Pakistan, UNFPA, around new funders. This is also something that this campaign is looking at doing, bringing new philanthropists on the fold, so to really get that message out on the power of family planning. So this will be a key priority for us as a hub, and it will also be continuing to work with country focal points, looking at key issues, creating opportunities for South-South learning, but also getting that message out. Back to you, Dakshita.
Thank you so much, Sumita. Thank you for highlighting the interventions we have taken collectively with our partners, as well as once again highlighting the importance of family planning in the context of low and declining fertility. So we are running out of time, but I'd like to give one more opportunity for all our panelists just to share very briefly. If I ask from you, what is your final message for the family planning community in the Asia and the Pacific region? Not more than 10 words. What is the message you would like our audience to leave today, take today when they leave, from your institutional point of view or your personal point of view? Not more than 10 words, very brief final remarks. So I can start with, I can see Anand smiling very nicely. I'm sure you have thought of something already. So we can start with Anand and then we can go one by one, but please be very brief. Thank you so much.
Family planning is not about population, it's about choice and agency.
Thank you so much, Anand. Thank you. Excellent. Upala?
I'm going to actually second what Anand just said. I'm going to say the right to bodily autonomy and the right to choose. They go hand in hand, and that's what we must strive for.
Right to bodily autonomy and right to choose go hand in hand. Excellent. I'm turning towards Kunana now.
For me, I think we can create a more inclusive, equitable, and effective of reproductive health and family planning landscape by working together to advance the gender informative family planning.
Thank you, Kunana. Creating more inclusive approach, which is extremely important. Thank you so much. Bilima, what is your final message?
I want to tell that young people already talked. They are talked now, so they are not waiting. And our task is not interfere. We just should support them. Yeah.
Excellent. Young people should be at the center of all our interventions. And if I may say, they are not the leaders of tomorrow, they are leaders of today. So thank you, Belema. And then I'm going to ask Sumita to share her final remarks. And once Sumita concludes her remarks, I think we have one more video to play. And after that, we'll be closing the webinar. So thank you so much, everyone. Thank you so much to all our esteemed panelists. And once again, thank you for your patience through all these technical difficulties we experienced today. We are very much looking forward to engaging you with our campaign and looking forward to also engaging you with a very specific webinar about the campaign, which we are hoping to organize on 17th of April. And we'll be sending you the registration details for that webinar to your email very soon. So keep an eye open for that one. Thank you so much towards our panelists and for all the audience today. So Sumita, over to you for final remarks, and we'll play our final video and conclude the webinar. Thank you.
So thanks, Dakshita. I think you covered it all. So again, once again, thank you to all our participants for joining today. Again, I deeply apologize for the delay and the technical glitches that we faced during this. Unfortunately, one of our panelists could also not join because of these technical issues that we faced. But thank you to all our panelists who are here, Anand, Upala, Belema, Nana. Thank you so much for giving us your time. We look forward to continuing engaging with all the participants who are here. Like I said, this campaign is not an FP 2030 campaign. It's a campaign for all of us, and we look forward to all partners taking it forward. And like Dakshita mentioned, on the 17th, we will be organizing a meeting with our communications director, who will again share some of the assets that we have around the campaign for all partners to implement and to take forward. Finally, I want to thank my own team. I want to thank Lira for conceptualizing and developing this webinar today. To Dakshita, Sadia, Joffy, and the entire team for all their support in making today's webinar possible. So thank you very much. And we have a beautiful video which has been put together by our youth focal points around the power of family planning. So we'll end the webinar with that. But once again, thank you for staying beyond the allocated time for this webinar.
It's about giving young people the opportunity to live healthy lives, to get an education, and to be empowered.
It's about having the right to make informed decisions
yang sangat bermanfaat dan cocok bagi keluarga muda yang ingin mengembangkan karir terlebih dahulu.
It is very difficult to find the information that are reliable, that are accurate, and also to find healthcare providers who give us services in a non-stigmatizing way. So,
promoting healthy families and communities. It empowers individuals to make informed choices about their reproductive health, leading to safer pregnancy
and ensuring that every child gets the best possible start in life.
Investing in family planning means having control over my future, my education, my career, and my health.
Everyone has the right to reproductive health education, contraception, and safe relationships.
Not only to pregnancy-related health issue, but more than that, such as in hormonal-related disease, conception can become a solution. And for STI prevention, we have condoms as also the family planning method.
Give people more chance to study, work, and have a better life.
More possibilities. At the end of the day, it's all about having power to decide. Your body, your future, your choice. Period.
Thank you so much, everyone. Once again, we look forward to your continuous engagement and collaboration. Thank you. Have a wonderful rest of the week.
Thanks, everyone. Bye.
Thank you. Bye. Bye.